Catherine had always been careful about her steps, especially when walking through the garden behind her cottage. The stone pathway that wound between the rose bushes and lavender plants had been her daily route for morning coffee for over 15 years. She knew every crack, every loose stone, every place where the morning dew gathered and made the surface slippery. But on this particular Tuesday morning in late September, something was different. The autumn rain from the night before had left everything glistening and treacherous. Catherine stepped out of her kitchen door, ceramic mug in hand, breathing in the crisp air that carried hints of wood smoke from neighboring chimneys. The garden looked beautiful in the soft morning light, with droplets of water catching the sun like tiny diamonds on spider webs. She had been thinking about William all morning. Her husband of 23 years had left early for his job at the construction site, kissing her forehead gently before stepping into the cool dawn air. He always worried about her walking alone in the garden, especially since she had turned 55 last month and complained occasionally about feeling less steady on her feet. Catherine had laughed off his concerns, reminding him that she had been navigating this garden since before they were married. The first few steps went smoothly as always. Catherine paused near the herb garden to check on her basil plants, noting that she would need to harvest them soon before the first frost. The oregano was thriving, and the rosemary bush had grown so large it was beginning to crowd the narrow pathway. She made a mental note to ask William to help her trim it back on the weekend. As she continued toward her favorite bench beneath the old oak tree, Catherine's mind wandered to the conversation she had with her daughter Sarah the evening before. Sarah lived 3 hours away in the city and had been calling more frequently lately, expressing concern about her parents living alone in their rural cottage. Catherine understood her daughter's worries, but she cherished the independence and peace that came with their quiet life away from the hustle and bustle of urban living. The bench sat in a small clearing, where William had installed a bird feeder 2 summers ago. Catherine loved watching the cardinals and blue jays that visited regularly, often bringing her camera to capture their vibrant colors against the backdrop of changing seasons. This morning she noticed a red cardinal perched on the feeder, its bright plumage a stark contrast against the muted autumn colors surrounding it. She was so focused on the beautiful bird that she failed to notice the patch of wet moss that had spread across the stone pathway during the recent rainy weather. The moss had grown thick and slippery, creating an invisible hazard that even her careful steps could not avoid. As Catherine shifted her weight to get a better view of the cardinal, her left foot landed squarely on the treacherous surface. The fall happened so quickly that Catherine barely had time to process what was occurring. One moment she was standing upright, coffee mug in hand, admiring the morning wildlife. The next moment her foot slipped backward, her body twisted awkwardly, and she found herself falling toward the ground with a force that knocked the breath from her lungs. The ceramic mug flew from her hand, shattering against the stone pathway in a spray of hot coffee in broken pieces. Catherine's shoulder hit the ground first, followed by her hip, and finally her head struck the edge of a decorative stone border that William had installed around the flower bed. The impact sent a sharp pain through her skull, and for a moment everything went black. When Catherine regained consciousness, she found herself lying on the cold, wet ground, unable to move her left leg. A throbbing pain radiated from her ankle up through her calf, and she could feel something warm trickling down the side of her face. She tried to call out, but her voice came out as barely more than a whisper. The cottage suddenly felt miles away instead of just 50 feet, and the realization of her helpless situation began to sink in. The cardinal she had been watching flew away, startled by the commotion, leaving Catherine alone with only the sound of her own labored breathing. She attempted to push herself up with her arms, but a sharp pain in her shoulder made her cry out and collapse back to the ground. Her head felt dizzy, and she was having trouble focusing her vision clearly. Catherine tried to remember what William had told her about his work schedule. He usually arrived at the construction site by 7 in the morning and worked until at least 5 in the evening. She glanced at her watch, squinting to make out the numbers through her blurred vision. It was only 8:30 in the morning, which meant William would not be home for many hours. The autumn air felt colder now that she was lying on the ground, and Catherine realized that her light cotton robe was not providing much protection against the chill. She could feel the dampness from the wet earth seeping through the fabric, making her shiver uncontrollably. The pain in her leg was becoming more intense, and she suspected that something was seriously wrong. As the minutes passed, Catherine's situation became increasingly desperate. She tried calling for help several more times, but her voice remained weak and she knew that their nearest neighbors lived too far away to hear her cries. The cottage sat on 5 acres of land, providing the privacy and tranquility that she and William loved. But now that isolation was working against her, she began to think about all the things she should have done differently. She should have waited for William to come home before walking in the garden after the rain. She should have worn better shoes instead of her soft slippers. She should have brought her cell phone, which was sitting uselessly on the kitchen counter charging. Most importantly, she should have listened to William's gentle warnings about being more careful as they both grew older. The sun climbed higher in the sky, but Catherine felt colder with each passing minute. She closed her eyes and tried to conserve her energy while hoping that somehow, some way, help would arrive before it was too late. William stood at the construction site, adjusting his hard hat as he surveyed the foundation work that needed to be completed before the weekend. The morning had started well, with clear skies and a good crew ready to tackle the day's challenges. As the foreman, William took pride in keeping projects on schedule and ensuring that every detail met the highest standards. He had been working construction for over 30 years, and his reputation for quality work had earned him respect throughout the county. But something felt off today. Since arriving at the job site at 7 o'clock, William had experienced an unusual sense of unease that he could not shake. He found himself checking his watch more frequently than usual and looking toward the direction of home, even though he knew Catherine would be fine. She had been managing their household and garden independently for decades, and there was no logical reason for his concern. During the coffee break at 9:30, William called Catherine's cell phone, something he rarely did during work hours. The phone rang several times before going to voicemail, which was not entirely unusual since Catherine often left her phone in different rooms while she went about her daily routines. Still, the unanswered call did nothing to ease the growing knot of worry in his stomach. His coworker, Mike, noticed William's distraction and asked if everything was all right. William explained his inexplicable feeling of concern, and Mike suggested that it was probably just the normal worries that come with middle age. After all, Mike pointed out, William and Catherine had been taking care of each other for over 2 decades without any serious problems. There was no reason to expect that today would be any different. William tried to focus on the concrete work that needed his attention, but his concentration kept drifting back to Catherine. He remembered how she had looked that morning, standing in the kitchen in her light blue robe, hair still tousled from sleep, smiling at him over her cup of tea. She had seemed perfectly fine, perhaps even more energetic than usual as she talked about her plans to spend time in the garden before the weather turned too cold. As the morning progressed, William's anxiety continued to build. During lunch break, he tried calling Catherine again, this time using the landline number for their house. The phone rang 10 times with no answer, which was highly unusual. Catherine almost always answered the house phone, especially during the day when she was expecting potential calls from their daughter or local friends. The afternoon dragged on painfully slowly. William made several mistakes that were completely out of character for him, including miscalculating measurements for a support beam and dropping a box of expensive hardware that scattered across the construction site. His crew members began to notice his obvious distress, and several suggested that he should take the rest of the day off to check on his wife. By 3 o'clock, William could no longer ignore the persistent feeling that something was terribly wrong. He approached his supervisor and explained that he needed to leave work early due to a family emergency. His supervisor, who had known William for over 15 years, immediately agreed and told him to take whatever time he needed. William's reliability and dedication had earned him considerable goodwill over the years, and everyone understood that he would not leave work early without a serious reason. The drive home felt like the longest 45 minutes of William's life. He pressed the speed limit on the winding country roads, his hands gripping the steering wheel tightly as he imagined various scenarios that might explain Catherine's absence from the phone. Perhaps she had decided to visit a friend without mentioning it. Maybe she had gone to town for grocery shopping and lost track of time. There could be dozens of innocent explanations for why she had not answered his calls. But deep in his heart, William knew that none of these explanations felt right. Catherine was a creature of habit who always let him know if she planned to leave the house during the day. She understood that he worried about her, especially since they lived so far from immediate help, and she was usually careful to keep him informed of her whereabouts. As William turned into their long gravel driveway, he noticed that Catherine's car was still parked in its usual spot next to the cottage. The sight should have been reassuring, but instead it increased his sense of dread. If Catherine was home, why had she not answered any of his phone calls? He parked quickly and rushed toward the front door, calling her name loudly as he approached the house. The front door was locked, which was normal since Catherine always secured the house when William was at work. He fumbled with his keys, his hands shaking slightly as he unlocked the door and stepped inside. The house felt eerily quiet, with only the sound of the grandfather clock ticking in the living room. William called Catherine's name again, louder this time as he moved through the room searching for any sign of her presence. Her coffee cup sat half empty on the kitchen counter, and her cell phone was plugged into the charger next to the window. The morning newspaper lay folded on the dining room table, apparently unread. Everything appeared normal, but Catherine was nowhere to be found. It was then that William noticed the back door leading to the garden was slightly ajar. Catherine sometimes left it open to let fresh air circulate through the house, but the cool autumn weather made this seem unlikely. William walked toward the door, his heart pounding as he pushed it open completely and stepped outside onto the wooden deck. From his position on the deck, William could see most of the garden pathway that Catherine walked every morning. The stone walkway curved through the landscaped areas they had developed together over the years, disappearing behind the large oak tree where Catherine liked to sit and drink her coffee. William called her name again, his voice carrying across the quiet garden. When he received no response, William began walking along the pathway, following Catherine's usual route toward the oak tree. As he rounded the curve near the herb garden, his worst fears were realized. There, lying motionless on the stone pathway approximately 50 feet from the house, was Catherine. Even from a distance, William could see that she was in trouble. His training in basic first aid from his construction job kicked in immediately. William ran toward Catherine while shouting her name, his voice filled with desperation and panic. The sight of his beloved wife lying injured and alone on the cold ground was almost more than he could bear. But he knew that every second counted in getting her the help she desperately needed. Catherine heard William's voice cutting through the fog of pain and confusion that had enveloped her, for what felt like hours. At first, she thought she might be dreaming, as she had been drifting in and out of consciousness throughout the long, cold morning. But as the familiar sound of her husband's desperate calls grew closer, Catherine realized that help had finally arrived. She tried to respond to William's voice, but her throat felt dry and constricted. The best she could manage was a weak moan that barely carried beyond her own ears. Her body felt heavy and unresponsive, as if she were trapped under an invisible weight that prevented her from moving. The pain in her leg had evolved from sharp stabs to a constant, throbbing ache that seemed to pulse with her heartbeat. William's footsteps pounded against the stone pathway as he ran toward her, and Catherine could hear him calling her name with increasing urgency. When he finally reached her side, she forced her eyes open and saw his face above her, etched with worry and fear. His work clothes were dusty from the construction site, and she could see that he was breathing heavily from running. William dropped to his knees beside Catherine, his hands hovering over her body as he assessed her condition. His construction training had taught him not to move an injured person, unless he was certain it was safe to do so. Catherine's position on the ground, the blood on her face, and her obvious pain suggested that she might have sustained serious injuries that could be made worse by improper handling. Catherine tried to speak, to tell William how relieved she was that he had come home early, but her voice emerged as little more than a whisper. William leaned closer, straining to hear her words. She managed to tell him that she had fallen sometime after 8 o'clock that morning, and had been unable to move since then. The admission brought tears to William's eyes as he realized that his beloved wife had been lying, injured and helpless for over 7 hours. William immediately pulled out his cell phone and dialed emergency services. His hands shook as he spoke to the dispatcher, providing their address and describing Catherine's condition as accurately as possible. The dispatcher asked detailed questions about Catherine's injuries, her level of consciousness, and whether she was experiencing any difficulty breathing. William answered each question while keeping one hand gently placed on Catherine's shoulder, providing what comfort he could without moving her. The dispatcher instructed William to keep Catherine warm and still while they sent an ambulance to their location. She explained that the rural location of their cottage meant it would take approximately 20 minutes for the emergency medical team to arrive. William felt his heart sink at the news of the delay, but he knew there was nothing he could do except follow the dispatcher's instructions and wait. After ending the call with emergency services, William rushed back into the house to gather supplies that might help Catherine. He grabbed several thick blankets from their bedroom closet, along with a pillow to help make her more comfortable. He also brought a bottle of water and a small towel, thinking that Catherine might be thirsty after lying on the ground for so long. When William returned to Catherine's side, he carefully arranged the blankets around her body without disturbing her position. The autumn air had grown colder as clouds moved across the sun, and William could see that Catherine was shivering despite her efforts to remain still. He talked to her constantly, sharing news about his day at work and reminding her of their plans for the upcoming weekend, anything to keep her alert and responsive until help arrived. Catherine found William's voice incredibly comforting. She had spent the long, frightening hours alone imagining all sorts of terrible scenarios, including the possibility that no one would find her until it was too late. Now, with William beside her, she felt a sense of hope returning despite the considerable pain she was experiencing. She managed to squeeze his hand weakly when he placed it in hers, a small gesture that meant everything to both of them. As they waited for the ambulance, William began to piece together what had happened. He noticed the broken coffee mug scattered across the pathway and the wet moss that had spread across the stones near where Catherine had fallen. The evidence painted a clear picture of an accidental slip that had resulted in serious injury. William felt a wave of guilt wash over him as he remembered his earlier concerns about Catherine's safety in the garden and wished he had been more insistent about his worries. Catherine could see the self-blame written across William's face and used what little strength she had to tell him that the accident was not his fault. She explained that she had been walking the same path safely for 15 years, and that there was no way either of them could have predicted that this particular morning would be different. Her words provided some comfort to William, but he still felt responsible for not being there when she needed him most. The sound of sirens in the distance brought a tremendous sense of relief to both Catherine and William. The emergency medical team was finally approaching their remote cottage, bringing with them the professional expertise and equipment needed to properly assess and treat Catherine's injuries. William stood up and walked to the edge of their property, waving his arms to help guide the ambulance to their exact location. The paramedics moved quickly and efficiently once they reached Catherine's side. They introduced themselves calmly and began conducting a thorough examination of her condition. Catherine answered their questions about her pain levels and described what she remembered about the fall. The medical team worked with practiced precision, checking her vital signs, examining her injured leg, and assessing the head wound that had bled significantly throughout the morning. After completing their initial assessment, the paramedics explained that Catherine appeared to have sustained a serious fracture in her left leg, along with a concussion from the head injury. They would need to immobilize her leg and transport her to the hospital for x-rays and further medical evaluation. The news was serious, but Catherine felt grateful that her injuries, while significant, did not appear to be life-threatening. The process of preparing Catherine for transport required careful coordination between the medical team members. They used a specialized backboard and neck brace to ensure that her spine remained stable during the move from the garden pathway to the ambulance. William watched anxiously as they worked, feeling helpless but grateful that Catherine was finally receiving the professional medical care she desperately needed. As the paramedics loaded Catherine into the ambulance, William quickly locked up the house and gathered the essentials he would need for what was likely to be a long stay at the hospital. His hands still trembled from the stress and adrenaline of finding Catherine injured, but he felt hopeful that they were moving in the right direction toward her recovery. The emergency room at Regional Medical Center buzzed with controlled activity as Catherine was wheeled through the automatic doors on a stretcher. William followed closely behind, his work clothes still dusty and his face etched with concern. The fluorescent light seemed harsh after the soft autumn sunlight of their garden, and the sterile smell of disinfectant replaced the fresh air and earth scents that had surrounded them just an hour earlier. Dr. Martinez, the attending physician, met them at the triage station. She was a woman in her early 40s with kind eyes and a calm demeanor, that immediately put both Catherine and William at ease. The paramedics quickly briefed her on Catherine's condition, the circumstances of the fall, and the vital signs they had monitored during the ambulance ride. Dr. Martinez listened intently while examining Catherine's injuries with gentle, experienced hands. Catherine was moved to a treatment room where a team of nurses began the process of making her more comfortable. They carefully removed her damp clothing and helped her into a hospital gown, all while maintaining the stability of her injured leg. The warmth of the heated blankets they provided was a welcome relief after spending hours on the cold ground, and Catherine felt some of her strength beginning to return. The first priority was managing Catherine's pain, which had intensified during the transport to the hospital. Dr. Martinez ordered pain medication that could be administered intravenously, providing faster relief than oral medications. As the medicine took effect, Catherine felt the sharp edges of her discomfort soften, allowing her to think more clearly about her situation and communicate more effectively with the medical staff. X-rays were the next step in determining the extent of Catherine's injuries. A technician wheeled a portable X-ray machine into the treatment room, and Catherine was positioned carefully to capture images of her left leg from multiple angles. The process was uncomfortable despite the pain medication, as Catherine had to remain completely still while her leg was manipulated into different positions for the clearest possible images. While they waited for the X-ray results, Dr. Martinez examined the head wound that Catherine had sustained when she struck the stone border around the flower bed. The cut had stopped bleeding, but it was deep enough to require several stitches. Dr. Martinez explained each step of the cleaning and suturing process to Catherine, helping to distract her from any discomfort during the procedure. William sat in a chair beside Catherine's bed, holding her hand and providing quiet encouragement throughout the various medical procedures. He had called their daughter Sarah from the hospital waiting room, explaining the situation and assuring her that Catherine was receiving excellent care. Sarah had immediately announced her intention to drive to the hospital, despite William's protest that such a trip was unnecessary. The X-ray results confirmed what Dr. Martinez had suspected based on her physical examination. Catherine had sustained a complex fracture of her left tibia, the larger bone in her lower leg. The fracture extended through multiple sections of the bone and would require surgical intervention to properly align and stabilize the pieces. Dr. Martinez explained that this type of injury was serious but certainly treatable with modern orthopedic techniques. Dr. Roberts, the orthopedic surgeon, arrived to consult on Catherine's case within an hour of the X-rays being completed. He was an older gentleman with silver hair and a reassuring manner, who had been practicing orthopedic medicine for over 25 years. He examined Catherine's leg carefully and reviewed the X-ray images on a computer screen, pointing out the specific areas of concern to both Catherine and William. The surgeon explained that Catherine would need surgery to repair the fracture, most likely involving the insertion of metal plates and screws to hold the bone fragments in their proper position while healing occurred. The procedure itself would take approximately 2 to 3 hours and would need to be scheduled for the following morning to allow Catherine's body to stabilize from the trauma of the fall. Catherine felt overwhelmed by the information about surgery, as she had never undergone any significant medical procedures in her 55 years. William could see her anxiety increasing and asked Dr. Roberts to explain the surgery in more detail, including what the recovery process would involve. The surgeon patiently answered all of their questions, emphasizing that this type of repair was routine in his practice and had an excellent success rate. The decision was made to admit Catherine to the hospital overnight for observation and preparation for surgery. Her head injury, while not severe, warranted monitoring to ensure that no complications developed during the night. The nursing staff moved Catherine to a private room on the orthopedic floor, where she would be more comfortable and could rest before the morning's procedure. Sarah arrived at the hospital just as Catherine was being settled into her room. She had driven straight from the city after receiving William's phone call, stopping only to arrange time off from work and pack a small overnight bag. The reunion between mother and daughter was emotional, with Sarah tearfully expressing her relief that Catherine's injuries were not more serious. The evening hours at the hospital passed slowly but peacefully. Catherine was able to eat a light dinner and felt much more comfortable thanks to the pain medication and the warmth of the hospital room. William and Sarah took turns sitting with her, sharing stories and gentle conversation to help pass the time until visiting hours ended. Dr. Roberts stopped by Catherine's room one more time before leaving the hospital for the evening. He reviewed the surgical plan once again and answered additional questions that had occurred to Catherine throughout the day. The anesthesiologist also visited to discuss the procedure and ensure that Catherine understood what to expect when she was taken to the operating room in the morning. As night fell, William reluctantly prepared to leave the hospital. He wanted to stay with Catherine, but the hospital policies only allowed overnight visitors in cases of critical illness. Catherine encouraged him to go home and get a good night's rest, reminding him that he would need his strength to help her during the recovery process that lay ahead. Before leaving, William held Catherine's hand and told her how grateful he was that his intuition had prompted him to come home early from work. If he had followed his normal schedule, Catherine might have spent the entire day and night alone on the cold ground, a thought that was too terrible for either of them to contemplate fully. Catherine squeezed his hand and reminded him that everything had worked out exactly as it was meant to. Sarah decided to spend the night in the family waiting area. Despite Catherine's protests that such sacrifice was unnecessary, she wanted to be close by in case her mother needed anything during the night, and also planned to be present when Catherine was taken to surgery in the morning. The nursing staff assured Sarah that they would keep her informed of any changes in Catherine's condition throughout the night. As Catherine settled in for her first night in a hospital bed, she reflected on the dramatic turn her ordinary Tuesday morning had taken. The fall in the garden had been terrifying and painful, but it had also reminded her of how precious life was and how much love surrounded her. Tomorrow would bring surgery and the beginning of a long recovery, but tonight she felt safe, cared for, and deeply grateful for the people who had rushed to help her in her time of need. The morning of Catherine's surgery arrived with a mixture of anticipation and nervous energy. Catherine had slept fitfully throughout the night, waking frequently due to the unfamiliar sounds of the hospital and the persistent ache in her leg. The pain medication helped, but complete comfort remained elusive as her body processed the trauma from the previous day's fall. William arrived at the hospital at 6 o'clock, carrying a small bag with items he thought Catherine might want after her surgery. He had packed her favorite book, a soft pair of slippers, and the framed photograph of their wedding day that usually sat on her nightstand at home. Sarah had spent the night in the waiting room and looked tired but determined to support her mother through the challenging day ahead. The pre-surgical routine began early, with nurses checking Catherine's vital signs and preparing her for the operating room. Dr. Roberts stopped by to review the surgical plan one final time and mark the correct leg with a surgical marker, a standard safety protocol to prevent any possible errors during the procedure. Catherine appreciated his calm confidence and felt reassured by his detailed explanations of what would happen during the surgery. The anesthesiologist, Dr. Patel, arrived to discuss the type of anesthesia that would be used during the operation. Catherine would receive general anesthesia, meaning she would be completely unconscious throughout the procedure and would not remember anything about the surgery itself. Dr. Patel explained the risks and benefits of this approach and answered Catherine's questions about what she could expect when waking up afterward. At 8 o'clock, the surgical team arrived to transport Catherine to the operating room. William and Sarah were allowed to accompany her as far as the surgical suite doors, where they shared emotional goodbyes and words of encouragement. Catherine felt nervous but ready to face the procedure that would begin her journey back to full mobility and independence. The operating room was a sterile, brightly lit environment filled with sophisticated medical equipment. Catherine was transferred from her hospital bed to the operating table, where the surgical team worked efficiently to position her leg and prepare the surgical site. The last thing Catherine remembered was Dr. Patel telling her to count backward from 10, and then everything faded to peaceful darkness. Dr. Roberts worked with practiced precision during the 3-hour surgery. The complex fracture required careful alignment of multiple bone fragments, and the surgeon used titanium plates and screws to provide the stability needed for proper healing. The procedure went smoothly with no unexpected complications or difficulties. The surgical team maintained constant communication throughout the operation, ensuring that every step was executed perfectly. While Catherine was in surgery, William and Sarah waited anxiously in the family lounge. The hours seemed to crawl by despite their attempts to distract themselves with magazines and conversation. Other families came and went, creating a steady stream of nervous energy that reminded them of the serious nature of medical procedures. Hospital volunteers offered coffee and words of encouragement, providing small comforts during the long wait. Dr. Roberts emerged from the operating room at 11:30 with excellent news. The surgery had been completely successful, with all bone fragments properly aligned and secured. The fracture repair would provide Catherine with the best possible foundation for healing, and Dr. Roberts expected her to make a full recovery with appropriate rehabilitation. The relief on William and Sarah's faces was immediate and profound. Catherine was moved to the recovery room, where specialized nurses monitored her as she gradually awakened from the anesthesia. The first few hours after surgery were critical for ensuring that there were no complications from either the procedure or the medication. Catherine's vital signs remained stable, and she responded appropriately to the nurses' questions as consciousness slowly returned. When Catherine was fully awake and alert, she was transferred back to her room on the orthopedic floor. William and Sarah were waiting for her, their faces bright with relief and happiness. Catherine felt groggy and disoriented from the anesthesia, but she was deeply comforted by the presence of her family and the knowledge that the surgery was behind her. The immediate post-surgical period focused on pain management and monitoring for any signs of complications. Catherine's leg was elevated and wrapped in bulky bandages that protected the surgical site. She was given patient-controlled analgesia, allowing her to manage her pain levels by pressing a button that delivered measured doses of medication through her intravenous line. Physical therapy consultation began the very next day, much sooner than Catherine had expected. Jennifer, the physical therapist, was an energetic young woman who specialized in post-surgical recovery for orthopedic patients. She explained that early mobilization, even in small increments, was crucial for preventing complications and promoting healing. Catherine would begin with simple exercises while still in bed. The first physical therapy session involved basic movements designed to maintain circulation and prevent blood clots. Catherine learned to flex and point her toes, rotate her ankles, and perform gentle stretching exercises with her uninjured leg. These activities were more tiring than she had anticipated, but Jennifer assured her that this was normal and that her strength would improve rapidly with consistent effort. Dr. Roberts visited Catherine daily to check on her progress and monitor the healing process. The surgical site showed no signs of infection, and Catherine's pain levels were manageable with medication. He estimated that she would remain in the hospital for approximately 5 to 7 days, depending on how quickly she progressed with physical therapy and pain management. The days in the hospital established a routine of rest, therapy, visits from friends and family, and gradual increases in activity level. Catherine received flowers and cards from neighbors, co-workers from William's construction company, and members of their church congregation. The outpouring of support reminded Catherine and William of how connected they were to their community. Even living in their rural cottage, Sarah had arranged to take time off from work to help her parents during Catherine's recovery period. She planned to stay at the cottage for at least 2 weeks, assisting with household tasks that Catherine would be unable to perform while learning to walk with crutches. William was grateful for Sarah's help, as his construction work required him to be away from home for long hours each day. The prospect of going home filled Catherine with both excitement and apprehension. She looked forward to sleeping in her own bed and being surrounded by familiar belongings, but she also worried about navigating their cottage with limited mobility. The bathroom was upstairs, the kitchen had several steps, and the garden pathway where she had fallen would be a constant reminder of how quickly life could change. Jennifer worked with Catherine to address these concerns by teaching her techniques for safe movement with crutches and strategies for adapting daily activities to accommodate her temporary limitations. They practiced going up and down stairs, getting in and out of chairs, and maintaining balance while performing simple tasks. Catherine's confidence grew with each successful practice session. On her 5th day in the hospital, Dr. Roberts determined that Catherine was ready for discharge. Her surgical site was healing well. Her pain was controlled with oral medications, and she had demonstrated competency with crutches and basic safety techniques. The prospect of leaving the hospital marked the beginning of the next phase of Catherine's recovery, one that would take place in the comfort and familiarity of her own home. The ride home from the hospital felt like a journey to a different world, Even though Catherine and William had made the same drive countless times over the years, everything looked exactly the same. Yet Catherine viewed her surroundings through the lens of her recent experience and newfound appreciation for ordinary moments. The autumn colors seemed more vibrant, the familiar landmarks more precious, and the sight of their cottage at the end of the gravel driveway more welcoming than ever before. William had spent the previous evening preparing their home for Catherine's return. He had moved a comfortable reclining chair into the living room where Catherine could elevate her leg, rearranged furniture to create clear pathways for her crutches, and installed temporary grab bars in the bathroom. Sarah had organized the kitchen so that everything Catherine might need was within easy reach from a seated position. The first few days at home presented challenges that none of them had fully anticipated. Simple activities that Catherine had performed without thought for decades now required careful planning and considerable effort. Taking a shower required a plastic chair and waterproof covering for her leg. Preparing meals meant sitting at the kitchen table and directing Sarah through tasks that Catherine could normally complete in half the time. Catherine found the adjustment to limited mobility more frustrating than she had expected. Her independent nature chafed against the need to ask for help with basic activities, and she sometimes felt like a burden to William and Sarah, despite their constant reassurances that they were happy to assist her. The enforced rest gave her too much time to think about the accident and worry about whether she would fully recover her previous level of activity. Physical therapy continued at an outpatient clinic 3 times per week, with Jennifer traveling to their home for additional sessions. The exercises gradually became more challenging as Catherine's strength returned and her surgical site healed. She learned to navigate stairs safely, walk longer distances with crutches, and eventually progressed to using a walking cane instead of the more cumbersome crutches. The garden pathway where Catherine had fallen remained untouched for several weeks after her return home. William had cleaned up the broken coffee mug and hosed away the bloodstains, but neither of them felt ready to address the moss-covered stones that had caused the accident. The area served as a visible reminder of how quickly their peaceful morning routine had been shattered by an unexpected moment of danger. As Catherine's mobility improved, she began to venture outside for short walks around their property. The first time she approached the site of her fall, her heart rate increased and her palms grew sweaty despite the cool autumn air. William walked beside her, offering his arm for additional support and gentle encouragement to take her time processing the emotions that arose from seeing the place where she had lain. Injured for so many hours, the psychological healing proved to be as important as the physical recovery. Catherine had developed an heightened awareness of potential hazards that made every step feel precarious. Wet surfaces, uneven ground, and dim lighting all triggered anxiety that she had never experienced before the accident. Jennifer recommended a counselor who specialized in helping people overcome trauma-related fears, and Catherine found these sessions helpful for regaining her confidence. 6 weeks after the surgery, Dr. Roberts cleared Catherine to begin putting partial weight on her injured leg. This milestone marked a significant step toward full recovery, though Catherine needed to continue using a cane for balance and support. The feeling of bearing weight on both legs again was emotional for Catherine, who had wondered during her darkest moments in the hospital whether she would ever walk normally again. The community support that had begun with cards and flowers during Catherine's hospitalization continued throughout her recovery period. Neighbors brought meals, friends offered transportation to medical appointments, and members of their church organized a schedule to ensure that Catherine was never alone during the day while William worked. The kindness of others touched Catherine deeply and reinforced her appreciation for the connections they had built in their rural community. Sarah eventually returned to her job in the city, but the experience of caring for her mother had strengthened their relationship in unexpected ways. The daily conversations and shared activities during Catherine's recovery had given them opportunities to connect as adults in ways that had not existed when Sarah lived at home. They began talking on the phone more frequently and making plans for regular visits that extended beyond holidays and special occasions. William's perspective on their lifestyle changed significantly after Catherine's accident. The peace and privacy of their rural cottage remained important to both of them, but William became more conscious of the potential risks associated with their isolation. He purchased a medical alert system for Catherine to wear, installed motion sensor lighting along the garden pathways, and made sure they both carried cell phones whenever they were outside. 3 months after her fall, Catherine was cleared to return to most of her normal activities. Her leg had healed well, though she would always have some mild stiffness and occasionally experienced discomfort during changes in weather. Dr. Roberts assured her that these residual effects were normal and would likely improve further with time and continued physical therapy. The garden pathway underwent a complete renovation before Catherine felt comfortable walking there regularly again. William removed all the moss-covered stones and replaced them with textured pavers that provided better traction in wet conditions. He also installed solar-powered lights along the entire route and trimmed back vegetation that had made some areas shadowy and difficult to navigate safely. Catherine's morning coffee routine eventually resumed, though with some modifications that reflected the lessons learned from her accident. She wore sturdy shoes instead of slippers, carried her cell phone, and chose a different route to her favorite bench that avoided the areas most prone to moisture accumulation. The simple pleasure of sitting in her garden with a warm cup of coffee felt like a precious gift that she would never again take for granted. 1 year after the accident, Catherine stood in the same spot where she had fallen and reflected on the journey that had brought her to this moment of healing and renewed appreciation. The cardinal that she had been watching on that fateful morning had returned to the bird feeder, its bright red plumage as beautiful as ever against the backdrop of autumn colors. Catherine smiled as she watched the bird, grateful for the reminder that life continues to offer moments of beauty and wonder, even after experiences that test our strength and resilience. The fall in the garden had changed Catherine and William in ways both profound and subtle. They had learned that independence and safety could coexist with proper preparation and awareness. Their love for each other had deepened through the experience of facing a crisis together, and their appreciation for community support had grown immeasurably. Most importantly, they had discovered that even in the most frightening moments, hope and healing remain possible when we open ourselves to the care and kindness of others.